The Libido Doctor is in.
Hi, and welcome to Libido Doc. I'm Dr. Suzanne Belibi, and today I would like to tell you a little bit about me to get to know me and see who is behind Libido Doc. I'm a medical doctor, I'm a wife, and I'm a mother. On this channel, I talk about human sexuality with a focus on heterosexual married women. I discuss all aspects of sexuality, including the biology, the psychology, the emotional aspects, the physical aspect, the social aspect, the erotic aspect, and also the spiritual. I learned from my mother how to be a wife. She taught me a lot of things, including how to take care of my feminine flower, how to take care of a husband, how to keep your bedroom and your marital bed on fire, what to cook to keep your husband strong in his manhood. So this is where I come from, and this is who I am. My parents sent me to Belgium to study medicine. And one of those weekends, I was spending the night at my best friend's house, and her childhood friend went to visit her. And when he saw me, he asked her who I was because he was interested in knowing me more. And from that time, he started pursuing me. And that's my husband. I'm talking about my current husband. We met 30 years ago at my friend's apartment. And he pursued me for 5 solid years. He did not give up. So what happened during those 5 years? We were going to school together, independently, but we were taking the same classes. And from time to time, he would visit me at my apartment. And when he would come, I would make him crepes, just being, a very wonderful host. Learned about him, talked about his goals, his plans for life, because I was really trying to figure out, what he had to offer. He was already a medical student, so I knew he was going to be a medical doctor, but I also needed to learn more about his character, his commitment, his sense of responsibilities, and really his vision for life, and where I would fit and help him, achieve some of the goals. So after 5 years, when I felt more comfortable, because those years were really dedicated to my studies, I didn't want to be distracted. I had goals, I had a vision for myself, and I had to succeed. I had to honor my parents who were paying for my medical studies in Europe. I was not about to play with that. So after 5 years, when I felt, ready for a relationship with him, I said yes. We got married right after we graduated, and we moved to the US. When we moved to the US, I had my first daughter, Francesca, and I was still learning English because all I knew was French. So it took me some time to learn English. Meantime, I was working in the lab. I worked in research for 3 years. After that, I went into residency, pediatric residency. After my residency, I did a fellowship in allergy and immunology. So after my allergy and immunology fellowship, I started working for a big group. I worked for them a little bit, then I started my own practice. And I've been in private practice for the past 12 years and counting. And it's been great. I see my patients as an extension of my family, and I really want to help them solve a lot of the issues they have, not just medical, the social, the academic. I help them set goals. I help them have a vision for their lives, just what I do with my children. And I've noticed that it makes me more fulfilled as a medical doctor. I just want to say that we are in certain positions. We are in positions of leadership, mainly to serve, mainly to fill the needs of the people who come to us. That's the reason why during COVID, remember COVID? We were in quarantine, it was really bad, we didn't really know what to do. I decided to stand in the gap because those patients who were affected were the extension of my family. They were the patients I've known for a decade. They were the parents, they were the children, they were the aunties, they were my family. So I decided to stand in the gap for them. So what I did when our first patient started, first of all, when they said to close the businesses and all of that, we decided not to close because we had to stand in the gap for our patients. When our first patient started complaining of the symptoms of COVID, we had them come to the clinic to test, to confirm. And then what I was doing, especially at the beginning, because we were still learning about the disease and we didn't really know what we were dealing with, I would sneak into my patients' houses and apartments and their bedrooms to go and examine them and listen to their lungs and ask about the symptoms and talk to them and figure out what I could do to help them feel better. And by doing that, I learned a lot. I learned how the lungs sounded when you had COVID. I learned the emotional distress, the headaches, the nightmares, and all that. So based on those interactions, I came up with combinations of treatments, and I would give it to the patients and follow up, call them and figure out how they were doing until we came up with the most powerful and effective treatment. Okay, I also have to say that I cheated a little bit because the Holy Spirit whispered into my spirit a combination of treatment that I could use. I just perfected it with the medical knowledge, with talking to my patients, with being with them and all that. I totally wasn't afraid. I wasn't afraid because you know what? If God be for me, who can be against me? Not even a virus. So I was super bold and I stood my ground. So those patients did well. They all survived. We had 0 deaths. And to me, that's a testimony of who I am, the type of person I am, the type of medical doctor I am. I'm dedicated to my patients. I'm dedicated to the people I love, and I want the best for them. Now, moving on to this new phase of my practice in which I focus on human sexuality. How did that come about? During the annual physical exam for women, most of the time they go through a pap smear. And because of the way I am, I always connect with my patients. I always ask questions. I'm funny. I instigate. I investigate. So I always ask them how it was going, in the bedroom with their husbands. And they almost always complained. And they complained about dryness, about pain, and how they were not enjoying their marital sexual life. But knowing my background and knowing what my mother taught me and knowing what I had been doing, I thought that I could help my patients. What is the Libido Kit? The Libido Kit is just a compilation of different products that are designed to create the most enjoyable sexual experience. It's an experience, okay? Because women like the process. They're not like men, right? So therefore, in this package, I thought about the things that even myself I do. You know, the cute little nightgown, or the sexy stocking that you can, the see-through, where you can, perceive the skin but not see everything. We have that there. We have linen spray to perfume your pillows, your bed sheets, and things like that. We have different lotions, mainly oil-based, to lubricate the feminine flower and to keep it moist, to keep it smelling good. We have a shea butter soap, just in case you want to clean yourself before you meet your husband. You don't have to, because sometimes you just have to be spontaneous, right? It doesn't have to be like that, but it's in there. We have a candle. We have some teas that are aphrodisiac, right? Because you need to help your husband. It's part of all those bedroom secrets my mother taught me, right? So I put together different barks, herbs, things like that, and it works. Our shot is for women, and we call that the orgasm shot, because we take your plasma, so it's very safe. It's something that comes from your own body, and we re-inject it in a specific spot in the vagina. And because of that injection, you begin to have very, specific good sensation. It just connects you back to those nerves that connects to your brain and bring you sexual desire that you had forgotten. Okay, and we also put a little bit in the clitoris. And when we do that, it just gives you better, more frequent orgasms from the clitoris. But hopefully you know that a woman can have multiple orgasms, right? It starts with the nipples, goes to the clitoris, the G-spot, the vaginal contractions, the cervical contractions, the uterine contractions. Women are just a package of beautiful, wonderful orgasms waiting to be ignited, okay? We need to know that. So that's what we offer for women, the O shot. And then for men, we offer the P shot. The P shot is, again, taking your plasma and re-injecting that in specific areas of the penis. And what that does is to give you better erections. It increases the length and the volume of the penis. And when couples do the procedure together, it just gives a better connection, a better tightness, a better just better everything. So that's what we do as hand-on procedures. Now for female, I also offer vaginal tightening, and we can achieve that with laser therapy, and we can also achieve that with some gels and from natural products that you can use not only to clean but to shape and to tighten also. So that's what we do as far as recreating this orgasm. But in this sexual education that I'm beginning to do, I also want to talk about all aspects and all subjects that affect human beings, right? I want to talk about the medical aspect of diseases that affect your sexual desire. I want to talk about the emotional, the social, the psychological. There is so much that goes into a marriage, right? We get married because we want to meet the needs of our spouses. We're going to talk about that. We're going to talk about communication. We're going to talk about the little things that you do to keep your marriage alive. And we're just going to talk about different things. But at the end of the day, I want you to know that I care about you. I care about women. I care about married women. And I really want to give you the tools. I want to give you the knowledge. I want to give you the confidence. And I want to give you, just this little thing. Okay? This little thing. To know that you can do it all, okay? You can have it all, and it's not impossible. So, welcome to Libido Doc. That was a little bit about myself. I hope you subscribe to the channel. I hope you follow me, and I hope you tell me what you want to learn about, and I will work with you, all right?